I'm McInerney from Croaky here at the moment, and we're at the Primary Healthcare Nurses Conference in Brisbane at the moment. And we've just had, in the quality session, I think, quality and safety session, and we just had a really interesting presentation. So I was hoping you could both introduce yourselves first.
Sure. So I'm Shelley Kerr, and I'm a Viral Hepatitis Project Officer in the Queensland program at ASHM, which is the Australasian Society for HIV, Viral Hepatitis and Sexual Health Medicine.
Thank you.
And my name is Melinda Hassall. I'm the clinical nurse lead for ASHM's nursing program and also based here in our Brisbane office.
Okay, fantastic. Now, your presentation was that you're developing an online module for nurses. Can you talk about what you're aiming to do with that and why?
So stigma and discrimination is still experienced by people who have a bloodborne virus, so hepatitis B, hepatitis C and or HIV, accessing healthcare. And stigma and discrimination becomes a real barrier for people accessing care, effective treatment and management for their bloodborne virus.
Can you talk about how it manifests?
Yeah, it can manifest in much poorer health outcomes with people not initially seeking treatment, so missing out on the really great biomedical interventions that we have, particularly for hepatitis C and now HIV with the introduction of PrEP on the PBS, and also manifests in their physical symptoms in late diagnosis and presentation, so much more advanced disease when they could have been accessing care much earlier, when they were sort of first diagnosed.
And what sort of, because one of the videos you showed said that most of the discrimination that's experienced by people with Hep C actually comes from healthcare staff. So what do they experience when they seek healthcare?
It could be really issues related to where they sit on a practice list, so they may be seen as the last patient. There's still anecdotes of people saying that they see on the medical chart HIV or hepatitis C or hepatitis B written across the front of their medical charts, or a sticker that says infectious on their medical charts. It could be that when someone discloses their bloodborne virus status, that a healthcare professional will take a step back or may wear 2 pairs of gloves to take a blood pressure, when in actual fact we should be using standard precautions for all of our care with all of our patients, because there are many people who may not be aware they have a bloodborne virus, or just who haven't disclosed because they don't feel comfortable, and it can be a really traumatic experience for some people.
And before we go on to the solutions you're hoping to do, why is that? What drives that? We expect the health system to actually understand risk better than anyone else. What is it?
Well, we all come to our professions with our own set of values and attitudes and perceptions, and sometimes they can be really challenged by people that we care for. The stigma around drug use is still quite high within our community, and particularly for people who have hepatitis C, that can be manifested in internalised stigma and other types of stigma that make it really difficult for them to access care. So I think this online learning module, it might be challenging at times for people to think about completing, because it really does make us reflect on our own practices as nurses, and none of us wish to think that we have been discriminatory or stigmatised any of our patients, so it can be quite challenging.
Shelley, can you tell us about what the online module will look like and what stage it's at and everything now?
Sure. So we've got the some of the creative through, so we had some of the graphics in there, so that's looking great. But it begins with an introduction by nurses, giving their perspective about why this is an important topic, and that's really in an effort to engage participants and to get them thinking about why it might be important to them. And there's also some lived experience videos throughout the module which can really highlight the impact that nursing care can have on the experience of people with bloodborne viruses. And we look at some intersectional issues as well, with culture the role that nurses can play in eliminating stigma, some sources of where stigma might come from, so lack of knowledge around transmission, that sort of thing as well. And then there's some reflective activities. So there'll be some questions that the nurses will pause and reflect on their own practice, and then there'll also be some interactive activities which they'll be scenario based, and they're based from the Stigma Indicators report from Centre for Social Research and Health, and they're more interactive and case study based.
And can you give a couple of examples?
So one of the, Melinda, you might be better placed to give an example of what one of the scenarios are.
The one that we presented in the session was a person with hepatitis B coming to the practice, and the GP not wanting to, verbalising that they didn't want to treat someone who might be from a refugee or migrant background because they were fearful of transmission of hepatitis B. And there's a question posed, would the nurses have the same response to the GPs, and then it's from extremely, like a Likert scale from extremely likely to not likely. And I guess that question just asks people to think about what's happening within their practice with their colleagues. Do their values and attitudes align with that? And if they don't, hopefully they don't, it gives them an opportunity to reflect on how they think themselves, but also how they might be able to engage their colleague in some education around that's actually not acceptable practice, and this is someone who really does need some care and has come to the practice to seek care and attention.
And with the module, do you expect, or when do you expect it to be ready? And how do you expect people to access it? Do you think is it an individual nurse thing out of work that somebody will do, or will it be more systemic than that?
Well, we're hoping that we've got a lot of partner organisations, so that it will be it'll sit on the ASHM online learning module platform to begin with, and so people can sit it in their own time. So whether they can do it while they're at work or if they can do it in their own time, it will be designed so that they can start it and come back to it. So it's really flexible, so that it will suit a lot of people wanting to do the module.
Fantastic. Thank you for letting me just grab you before you actually